I just want to let you all know that we are recording this for the benefit of everyone. I'm going to post this so that people who couldn't make it today will hopefully be able to listen and get the same information. I want to thank you all for coming and welcome you. My name is Caroline Kusenza. I am a midwife at the Monterey Birth and Wellness Center. And I'm just here to moderate. And if you guys have questions, please feel free to put them in the chat feature, and I will gather the questions and add them to the list of questions at the end for Dr. Nothnagle. And I also would like to thank you, Melissa, for coming and for sharing the information. Everyone, we have Dr. Melissa Nothnagle with us. She is a wonderful doctor. She also happens to be our medical director at the Birth Center, as well as chief of family medicine at Natividad. Thank you so much, Melissa.
Thank you. I'm so happy to be here. So as Caroline mentioned, I'm a family doctor, and I've been caring for patients hospitalized with COVID at Natividad for more than a year, both pregnant and non-pregnant patients, because I do inpatient hospital work as well as maternity care. There have been so many new developments with COVID this summer, and a lot of incorrect information circulating out on social media. So I know people have lots of questions. So I thought that I would start with reviewing the current situation with the Delta variant, as well as the state of the science on COVID in pregnancy and vaccination in pregnancy, because there's been new data released recently and changes in our recommendations. And then we can get into questions. And if I can explain in more detail anything that I've gone over, I'm happy to go back to that too. So, the big difference that we're seeing right now with the Delta variant this summer compared to the other variants of COVID is that it's so much more easily transmitted from one person to another. Even in people who've been vaccinated, this variant replicates so quickly that it's in our upper airways and can spread to other people before our full immune response kicks in if we've been vaccinated. So we're seeing it spread really quickly through our communities. And especially now that things are open and kids are back in school and people are, trying to get back to normal. It's also just been a great opportunity for a fast transmitting virus to spread very quickly in the community. The good news about where we are right now is that previously, like in the winter surge, when our case rates in the community went up, when the infection rates went up, the hospitalization rates went up dramatically too at the same time. And we're seeing that in areas of the country with low rates of vaccination, where you see those, ICUs being full in the South. Those are states with very low vaccination rates. But in places like where we have higher vaccination rates, such as around here, we're not seeing those same high rates of hospitalization. The vast majority of people getting hospitalized with COVID right now are people who've not been vaccinated. And the deaths that we're seeing from COVID at this point are even more tragic because they almost all could have been prevented with the vaccine. But most of us are here today because we have special concerns about COVID in pregnancy and lactation. So I want to talk about that. We do know that when pregnant people are infected with COVID, they are at higher risk for complications and severe disease. The pregnancy-related changes in how our body functions can explain why the virus is more dangerous in pregnancy. Our lung capacity is reduced because abdominal organs are pushed up into the chest cavity, and the changes that happen in the immune system that protect the fetus from being attacked as if it were some foreign invader lower our resistance to infections. So what we see in data that's been coming out since the beginning of the pandemic, and we have more and more data now on COVID infection and pregnancy, among pregnant people with COVID compared to non-pregnant people with COVID, we have an increased risk of being hospitalized, of being admitted to the ICU, of needing to be put on a ventilator, and of dying from COVID. There's multiple studies that have found those same findings. In general, we see the same comorbidities putting people at higher risk as in the general population. So people who are pregnant who have higher age or have diabetes or hypertension or obesity are more likely to have those complications, just like non-pregnant people with those conditions. And in general, we see the same symptoms of COVID in pregnancy as we see in the general population. It doesn't manifest differently in a pregnant person. Of course, like in the rest of the pandemic, COVID is hitting pregnant women of color harder than other communities, and we see higher rates of infection and hospitalization among pregnant people of color. The other important thing to think about is comparing pregnant people with COVID to pregnant people without COVID. They definitely have a higher risk of preterm birth. And some of that is related to COVID-related complications that require preterm birth to improve the health of the pregnant person by taking the physiologic burden of pregnancy out of the picture if someone's critically ill. So sometimes an early birth is indicated for that reason, or because complications develop like high blood pressure or blood clots that we see more often in pregnancy with COVID. The good news for babies, we see very low rates of transmission from across the placenta to infect the fetus. They haven't actually, I don't think, found any conclusive cases of transplacental transmission. And infants who test positive are very rarely going to get severely ill. Most of them are asymptomatic. We have small studies showing that the virus does not get into breast milk. So we encourage breastfeeding even if the birth parent is COVID positive. We have them wear a mask and wash their hands before breastfeeding. So I want to switch over to talk about the research on COVID vaccines in pregnancy. And just to mention, I know there's different rumors about this going around that these vaccines were fast-tracked and shortcutted. They went through the same rigorous testing process as all other vaccines before they were authorized for emergency use. The part of the reason that they went so fast is because there was more money behind this than any other vaccine implementation process in history, I think. But like with many medical interventions, testing these vaccines in pregnancy was limited. We don't test a lot of medications or vaccines in pregnancy, especially at the outset. So pregnant people were not included in those phase 3 randomized controlled trials that were done last fall to get the emergency use authorization. But since then, the data on vaccination in pregnancy has really been growing and clearly suggests that the benefits of receiving the COVID vaccine outweigh any known or even potential risks of getting the vaccine during pregnancy. And that's what led to the new recommendation from the CDC and ACOG, the American College of Obstetricians and Gynecologists, a couple of weeks ago, that pregnant people should get the vaccine. Previously, the recommendation was discuss it with your doctor, think about the pros and cons. Now we really feel that the data is clear that the benefits clearly outweigh the risks of vaccination in pregnancy. So I want to just quickly review some of that data that led to that decision. So the first question is always going to be, is it safe? We don't want to use an unsafe vaccine in pregnancy. So they start with animal studies, and all 3 of the authorized vaccines in the US had, excuse me, animal studies looking at animals before and during pregnancy and looking at effects on the pregnant animals and their babies. They used much higher doses of the vaccines than are used in humans to be sure that they would uncover any potential risks. And they found no safety concerns in either the pregnant animals or their offspring. We also have data from previous clinical trials that use the same vaccine platform as the J&J COVID-19 vaccine. There were no adverse pregnancy-related outcomes, including any adverse outcomes affecting the baby. And those were several trials, including the large-scale Ebola vaccination trials that used the same viral vector as the J&J vaccine. And it was given to pregnant people in all trimesters of pregnancy. And then in terms of the mRNA vaccines, the growing data that we have so far on the Moderna and the Pfizer BioNTech are very reassuring in terms of use in pregnancy. So for any of you that have gotten vaccinated, you may remember the vSafe app that they told you to sign up on your phone. So the CDC has this after vaccination health checker that has people report any symptoms or complications that they have after vaccination. And it's an opt-in application to report symptoms. And as of yesterday, there were more than 148,000 people in the US who reported being pregnant when they got the vaccine, who are in that database reporting their symptoms or complications. And there are also several national pregnancy vaccine registries that are collecting more in-depth data prospectively on pregnant and breastfeeding patients who got the vaccine. And the CDC has about 5,000 people enrolled in their pregnancy vaccine registry, and then University of Washington released data last week based on 17,000 patients. So in those big monitoring groups, of large groups of pregnant women getting vaccinated, there were no safety concerns identified among pregnant people or their babies. There were similar types of and prevalence of vaccine side effects seen in pregnant and breastfeeding people in the vaccine registries. Really important, and this just came out a couple of weeks ago, there was no increased risk of miscarriage seen in those who received the mRNA vaccines prior to 20 weeks of pregnancy. That's very reassuring. Many pregnancies, of course, that are reported in these safety monitoring systems are ongoing, and they're continuing to collect more and more data so that we can better understand any effects on pregnancy and babies. So that's the safety data. The next question is, does it work if you're pregnant? As I mentioned, the immune system is a little bit different in pregnancy. We want to make sure that the vaccine is going to be effective. And we do have data on the mRNA vaccine during pregnancy reducing the risk of infection. This was an Israeli study comparing pregnant people who received the mRNA vaccine versus those who did not, and it definitely lowered the risk of infection. It wasn't a large enough sample to really look at differences in hospitalization rates, and it was done during a time when there wasn't a lot of transmission of virus in Israel, so there weren't as many infections as they would have hoped to study to be able to really pin down the differences in serious infection. But that's reassuring. They really reduced the risk of overall infection, similar to what we saw in the phase 3 clinical trials in non-pregnant people. The other good news that we got recently was about antibody production in vaccinated pregnant people. So particularly around the mRNA COVID-19 vaccine, we learned that recipients produce antibodies similarly to non-pregnant people, and they were found in umbilical cord blood, meaning they're crossing the placenta to the fetus, and found in breast milk. So those should help protect babies against COVID-19. Again, we don't have long-term data to know how much they protect them, how much you need to be breastfeeding in order to offer protection to your baby. But this is similar to the strategy that we have of immunizing pregnant people against pertussis to give that passive immunization to the baby who can't be immunized against it. Similarly, with the influenza virus, antibodies from the parent pass to the baby who can't be vaccinated until they're a little bit older, but for help protect them from influenza infection. So just to conclude, I think based on all this existing data that I've talked about and what I'm seeing in the clinical environment, I'm very convinced that the risk of being unprotected against COVID-19 and developing severe disease far exceeds the risks of the vaccine, including and maybe even especially for pregnant people. And CDC, ACOG, and the American Academy of Family Physicians are all in agreement with that and are recommending vaccination for people who are pregnant or lactating. We have lots of questions, I know, so we can jump right into that. And we have some questions that Caroline and the folks at the Birth Center collected ahead of time, and I really encourage people to put additional questions in the chat as we go along.
Thank you, Dr. Nothnagle. The first question is, would you recommend one vaccine over another for pregnancy?
That's a great question that's coming up a lot. So all three of the authorized vaccines are considered very safe and effective in pregnancy. One difference to consider in places where we have access to all 3 vaccines is that there is a rare side effect with the J&J vaccine that we've seen in women under 50. And it's called thrombotic thrombocytopenia, which is blood clots and low platelets. It's extremely rare. I think there were about 9 cases per million women aged 18 to 49, but it's not a side effect that we've seen with the Pfizer or Moderna vaccines. So in our area, we have great access to vaccines, so you'll usually have a choice.
Just a follow-up question to that, if you don't have a choice, is it better to just get whatever's available?
Yes, I would, if Johnson & Johnson is the only one that was available, I would absolutely get it. Again, it's just thinking about the risks of getting a COVID infection versus the risk of getting this very rare side effect of 9 cases per million with the vaccine. And clearly from what I'm seeing in the clinical environment, I would say I would take that very small risk, because the risk with COVID is not very small. It's very serious.
Next question, does the vaccine negatively affect fertility? We get this one a lot.
Yes. So this one's running rampant around the internet. It sounds like it started on Facebook. I read an interesting article about like the history of this rumor and other social media rumors. And it was like really amplified on social media and then picked up by the mainstream media. So everyone's talking about it, and it's very scary. But the good news is there's no scientific evidence that the vaccine affects fertility. Even if we were to think hypothetically about it, based on our current science, there's not any credible mechanism by which the mRNA vaccines would affect future fertility. A lot of people are expressing worries about long-term side effects of vaccines, these vaccines in particular, I mean, because we've only been using them for about a year. But when you think about all the vaccines that we use for the many different diseases that we've successfully controlled with vaccines, even some of the vaccines that we had to take off the market because of side effects, we don't have any vaccines that have shown long-term side effects. None. Any adverse reactions with our vaccines happen in the first 4 to 6 weeks. So there's no reason to think that these vaccines would be any different. Particularly the mRNA vaccines. The mRNA is so unstable. It's broken down in our body in a matter of days. It's not sticking around to cause long-term side effects.
Another good question I hear a lot. Do I need to get vaccinated if I've already had COVID?
Yes, this is a question that's coming up all the time. We know that the people who have the highest levels of antibody protection are those who've had the infection and then get vaccinated. So I'd say, yeah, you want the highest levels of antibodies you can possibly have. Go get it. The issue is that people with mild infection don't get as vigorous an immune response as with vaccination or with severe disease. And I definitely don't want to recommend people to go out and get severe disease. Hopefully, if you've had COVID, it was mild, and you're going to get a better, prolonged, sustained antibody response if you then get the vaccine. And there's some interesting science behind why the natural immunity with COVID is not as good as compared to some other viral infections that we see. And it's because the incubation period is very short. So it doesn't give our immune system time to really build up that long-term memory to respond later when we get re-exposed. So an interesting example that you all know about is chickenpox, right? So that is a 2-week incubation period. And we know that once people have had chickenpox, they almost never can get reinfected. We have a very robust immune response because of that in that incubation period. So that's just sort of an interesting piece of science around that. So the bottom line is we do recommend vaccination even after natural infection, just to make sure that you have a really vigorous immune response.
Is this the first vaccine not made from a live virus?
No. So we only have a few live virus vaccines. The MMR, the varicella, and the nasal flu vaccine are the only live virus vaccines that are currently in use that I can think of. those are vaccines that we avoid using in pregnancy because of that changes in the immune system. We don't give them to other immunocompromised people either. So other vaccines use viral vectors or inactivated virus to bring the DNA and the viral proteins into the body so that our immune system can see them and prepare for a response when we see those proteins again if we get infected by the virus in the future.
Are there preservatives or other additives that can negatively affect fertility, pregnancy, or lactation?
Yeah, so I've looked through all of the ingredients and read about them. You can get into the nitty gritty if you want. There's a great TED Talk released this month by one of the engineers who helped develop the nanoparticles that hold the mRNA to protect it as it goes into the cells. And there's no ingredients that would raise concern for adverse reproductive health outcomes. The mRNA vaccines have mRNA. They have ingredients that are naturally found in our bodies, like mRNA, lipids, cholesterol, potassium, sodium, sucrose, and the only the other ingredient is polyethylene glycol, which is many of you may be familiar with Miralax, which is a laxative. That's polyethylene glycol. So it's used in a lot of cosmetics and household products. It's possible to have an allergic reaction to polyethylene glycol, but you would probably know that if you've had it because it's so present in a lot of our environment.
This is a good one. When in my pregnancy should I get vaccinated? Should I avoid the first trimester?
Well, I'll say getting it before pregnancy is preferable so that you're protected before you have those immune system changes related to pregnancy. But if you, and just to say that if you take your first dose of vaccine and then become pregnant, ACOG is recommending continue, get your second dose as predicted or as scheduled. We need more research, I think, to determine what is the best time in pregnancy to give it to get the best antibody response. So, but in general, we're recommending, get it as soon as you can, because the longer you don't have it, the longer you're at risk for a COVID infection. I will talk about the first trimester issues though. In the first trimester of pregnancy, we try to avoid hyperthermia or high body temperatures like you'd get with the fever or going in a hot tub or a sauna, because there is some association between that and a higher risk of miscarriage. The vaccines can cause a fever in a minority of people. It's usually about 10 to 15% of people will get a fever, usually after their second shot of the mRNA vaccines. But getting a COVID infection also will cause fever, right? So again, it's weighing one against another. If you do get a fever after vaccination, we recommend taking acetaminophen, which is Tylenol, to reduce the fever and reduce that potential risk. I think that's the main thing. Just to reiterate the trial data that came out recently about miscarriage risk being similar in folks who received the vaccine before 20 weeks and those who did not was very reassuring. So early pregnancy loss is really common, up to 20% of recognized pregnancies. And this safety data was looking at Pfizer and Moderna, both the mRNA vaccines, and found a miscarriage rate of around 13%, which is well within the expected range. So that's very reassuring.
This question is specific to lactation. Is it safe to get while lactating?
Yes, so the vaccines can't cause infection in anyone, including the breastfeeding parent or the baby. And they are effective at preventing infection in people who are breastfeeding. And as I mentioned, the potential benefit of the antibody production in the breast milk could potentially protect the baby, but we don't really have data to prove that just yet, but we think it probably would.
I think you've already covered some of these questions. It was about research, which you've already covered for getting the vaccine in pregnancy. And do we have a number or a ballpark number of how many pregnant people have received the vaccine thus far? Or we have to kind of cobble it together with different sources?
Yeah, it's hard to cobble together. As I mentioned in the CDC database, the VSafe reporting database, there's almost 150,000. And there's, obviously a lot more if you look at global data. And then there were a number of people even in the phase 3 trials who became pregnant, even though they weren't supposed to when they were in that phase 3 group. It was a small number of people. Interestingly, there were no complications in the vaccine group. There were a number of miscarriages in the placebo groups only, but it was really, we're talking about 25 pregnancies in the vaccine group and 25 in the placebo group. So very small numbers, but reassuring nonetheless.
Yeah. Do we know how long antibodies are active in baby when mom is vaccinated during pregnancy or during lactation?
Yeah, that's a great question. It should correlate pretty much to the antibody levels in the maternal serum. So we're still learning about how long that antibody response lasts. And we're just getting this data now from places that vaccinated early, such as in Israel, that we start to see declines in antibody levels in the 6 to 8 month range. So that's why this whole discussion about booster vaccines is coming up now. I would think that we can say as long as you're within 6 or 8 months of vaccination, that there should still be antibody production that's crossing the placenta or being passed into breast milk.
I just got a question on chat, which is related, so I'll read it ahead of the other questions. Are there studies available for us to enroll in for breastfeeding with the vaccine? I'd love to help further research in any small way.
That would be great. I would really encourage everybody, if you can sign up on the CDC website through VSafe. If you didn't do it when you got the vaccine, you can do it anytime after you've gotten the vaccine, and they'll collect your data on when you got it and ask for symptoms. And then they will invite certain qualified people to be part of the registries, but they start with the VSafe database to do those invitations. And if I hear about more studies, I'll pass that info on to the birth center folks so they can share that.
Oh, this is an interesting one. I had not actually heard of this, but has there been any research on the widely anecdotal reported vaginal bleeding after vaccination? I hadn't heard about this.
Yeah, I've been hearing about that too, that there's people saying, well, I missed my period after I got the vaccine, or my cycle was heavier. We don't have any prospective data yet on changes in the menstrual cycle after vaccination. What you'd really ideally need to do to look at menstrual cycles in those who got the vaccine and those who got the placebo, and really look at that in real time. And to my knowledge, they did not collect menstrual cycle data in those phase 3 randomized trials, because they were really focusing exclusively on safety events and rates of severe infection and hospitalization. So we don't really know.
Maybe pending, right?
Yeah.
Are there any side effects for the vaccine that are more intense for pregnant people that are also immunocompromised? So both pregnant and immunocompromised side effects. That's kind of a.
Or is it that, did they mean that people who are pregnant are immunocompromised, or?
I think they're asking, I'll need to read it again, this word for word. Are the side effects, I think I might have mistyped this because it doesn't read well.
I think that is my question, actually.
Yeah, go for it. Want to explain what you want?
My question is, since pregnant people are immunocompromised, are there going to be more intense side effects and that kind of stuff?
Great question. Thank you. You'd actually, in people with a kind of suppressed immune system, you'd expect vaccine side effects to be less intense in general, but we actually see a pretty similar range of side effects in the studies comparing pregnant and non-pregnant people. So both the type of side effects and how often they happen. So the arm soreness, which is the vast majority of people have soreness in the arm for a couple of days where they got the vaccine. And then about half of people will get fatigue, headache, or muscle aches. And then a much smaller percentage will get fevers. Those are the main things that we see.
That sore arm is no joke.
No, no, it's serious.
I think you've actually already answered this, but I'm just going to go ahead and read it out just because I want everyone to feel that their questions were addressed. But this one is, have there been any long-term studies on child development on an mRNA vaccine like the COVID vaccine, which of course is, as we know, new?
Right. No, so we don't have studies on long-term effects on child development with the mRNA vaccines, to my knowledge. There have been a number of other mRNA vaccines that have been tested, like for HIV and Ebola, and I think it's got some really incredible potential for the future. There's so many different ways that mRNA vaccines could be used for many different diseases, like things like cystic fibrosis and muscular dystrophy. It's really an incredible technology that's been developed thanks to COVID. But the reassuring thing to me is that there haven't been any long-term effects on child development noted with any of our existing vaccines. And I know people will bring up the autism question. That research was completely debunked. It was falsified data. It's retracted. It's not true. Vaccines don't cause autism. These vaccines all work in similar ways, right? They present foreign proteins to our immune system to prompt a vigorous response when we encounter the virus again in the future. The only difference with the mRNA vaccine is that it uses our own muscle cells to make that foreign protein. And the vaccine ingredients then leave the body very quickly. So we wouldn't expect different long-term effects. But the fact is we don't have long-term data.
So for someone who is going to receive the vaccine, I guess after have chosen to receive the vaccine after they've given birth, what would be the recommended time frame for how long after they gave birth, and what would be the rationale behind that time frame?
So I wouldn't recommend waiting till after giving birth. I think, before we had this new data that came out in the past month or so, we were saying like, well, weigh the risks and benefits. We don't really have enough data to say, but now we really clearly have enough safety data that all of the major medical organizations feel very comfortable recommending this for pregnant patients. So I would not wait till after giving birth. I would get it as soon as you can. If you are not convinced by this data for whatever reason, and you want to wait till after giving birth, get it right away as soon as you can, because the longer you wait, the greater your chance of getting a natural infection. There's a question in the chat, Caroline. I don't know if you saw
Yes, this is a good one.
Yeah.
How long would you recommend waiting after getting the Tdap during pregnancy, I guess, in relation to getting COVID vaccinated?
Yeah, so the latest recommendation is that we can give all of these vaccines at the same time. So we can give the flu vaccine, the Tdap vaccine, and the COVID vaccine on the same day even. There's no difference in terms of immunogenicity because they're presenting different proteins to the body and making, different antibodies are being made to each one. Tdap is usually a pretty benign one. People don't tend to get fevers afterwards, similarly with influenza. So I think it just depends on, how much arm soreness you can tolerate and what you have to do the next day. But we recommend the Tdap around 28 weeks. We recommend influenza vaccine for everybody who's pregnant, and that's just starting to come out now. I think that we're going to see a very different influenza season this year. Last year, there was almost no flu because we were all inside and masked and not doing normal things. And now that we're doing normal things and our kids are back in school, there's going to be a lot of flu. And flu is another, I'm just going to go on my flu soapbox for a minute. Flu is another infection that's very dangerous for pregnant people. I tell folks who are concerned about it, like when we have a vaccine shortage with influenza, because it's much harder to produce than the mRNA vaccines, like for COVID, the people that we prioritize are nursing home patients, pregnant people, and tiny children. So those are the most at risk of death from influenza. And we had a really sad case in my former job, one of our OB residents who was pregnant died of complications of influenza. It's really can be serious in pregnant people. So do also get your influenza vaccine this fall along with your COVID vaccine.
Do we know how long antibodies remain in the baby when mom is vaccinated during pregnancy? I think had a similar question already. I think you've already answered.
Yeah, it should be as long as the serum levels are high in the vaccinated person.
And actually, that was the last question, unless anybody, I'll maybe give it a couple more minutes if anybody else wants to chat or come on and ask another question. The pressure is on. And since
I'd actually like to bring something up that we have had quite a few clients who have expressed concern with family members not wanting to get vaccinated. Do you think it would be best for them to bring it up that it is best for them and the baby? Maybe it would be help to hear your side for them to talk to their families about it.
That's a great question. Yeah, it's similar to how we counsel people around the influenza vaccine and the Tdap vaccine, right? So because we can't protect babies against these viruses, we protect all the people around them who could bring it into the house. So making sure that all the adults in the home of a new baby get the pertussis vaccine, get the influenza vaccine, and now get the COVID vaccine to protect the folks that are the most vulnerable. And I think encouraging folks to go to reliable sources. So folks that are hesitant about getting vaccinated themselves, really encouraging them to go and talk with their primary care physician. I think people tend to have more trust in their primary care physicians. And if anyone has a chance of convincing them about the safety of them, that might be the person. But seeing if they can, do it for their own family member, protecting that vulnerable infant, that might be the thing that changes their mind.
I like that. Got a couple more questions on the chat. So one of our people who've joined us says, I know someone who has recently miscarried at 6 weeks. Should she wait for a regular cycle before getting the vaccine, or no need to wait?
I can't think of any reason to wait. Again, in general, waiting means you have more chance of getting infected. And there shouldn't be, after a miscarriage, we don't really know about the timing of the next cycle. It's pretty unpredictable. So I think getting it now may relieve her potential worries about getting vaccinated during pregnancy, and it'll get them protected early on.
And if she were to miscarry, unfortunately, again, which would be awful, hopefully that doesn't happen. I think a lot of what the concerns are, my concerns are anybody who miscarries is going to think, oh, it was because of the vaccine.
I think that's a really hard thing when miscarriage happens, we really rack our brains to see, like, what did I do? What did I eat? Something? Did I have a glass of wine? Did I run for the train? Like, what, people really put a lot of blame on themselves in trying to puzzle out why this could have happened to them. So if it's only psychological, trying to get vaccinated before getting pregnant may be helpful with that, if in case a miscarriage does happen, but I hope not for her.
Yeah, I hope not. One's enough. And this is similar to the pregnancy question about which vaccines might be recommended. So is there one particular vaccine you would recommend during breastfeeding over another? Would you make the same recommendation as for pregnancy?
Yeah, I mean, I think the reason for leaning towards the mRNA vaccines over the J&J is just the demographic of women from 18 to 49. So if you're still in that demographic and you have a choice, you may want to go with the mRNA vaccine. So Pfizer or Moderna.
Mm-hmm. It seems like recommendations regarding infants is conflicting, that babies often have mild infection, but are considered higher risk, ? Not sure how protective to be of my baby around unvaccinated people. Good question.
That's a great question. And I don't have a really clear answer for you. So the data that we have on newborns that I was referring to is really looking at newborns of COVID positive parents, birth parents. And so those babies immediately get tested at 24 hours. And so the ones who've been tested positive in that very early phase, which is, it's pretty rare actually that they do test positive, but they mostly have mild infection or asymptomatic infection. I don't think we really know with the Delta variant what that looks like in kids. We are definitely seeing higher rates of hospitalization among children right now. And we don't really know what's behind that, whether it's just that because this is spreading so much in the community, more unvaccinated people are getting it. Our demographic shift of hospitalizations is going younger because we were successful in vaccinating a lot of older adults. But I think there's some suspicion that Delta could be causing more serious illness in younger people, but we don't really know yet. So I think if I had a newborn right now, I'd want to protect them in general from infections. And now people know how to do that. They wear masks, they wash their hands, they get vaccines. But it's a good question. I don't think we have a super clear answer.
Just thought I'd give it a minute or two, see if anybody had another question, but it seems to be winding down perhaps.
A lot of people ask kind of where to go for information, and I always recommend the CDC, Centers for Disease Control website. They have direct links to all of the studies that I mentioned around the pregnancy data in particular. So you can read them on your firsthand if you want to dig deep into the data and where it's coming from. And they'll update that as new data comes in. So that's a really helpful source, and it's very reliable.
Well, I guess we didn't get any more questions, so I just want to take a moment to thank you so much, Dr. Nothnagle, for taking the time out of your weekend to inform us. And thank you guys, everyone else who joined us today. We appreciate your questions and your joining with us. And I'm going to post this recording as soon as I figure out how to do this. I'm going to post this both on Instagram and Facebook. And please do share widely so this information can go out to more people. Thank you very much.
Thanks, everybody.
Bye-bye.